right, so anytime we have right here Madam Edna, yes, you know that she's right here to give us all the information we need to know regarding our health. But today we're talking cervical cancer, understanding cervical cancer causes, symptoms, and the risk factors. So let's delve into the conversation. You are home too. Conjoining, we have our social media platforms very active. The Shobiz TV and Facebook, Instagram, YouTube. Our WhatsApp numbers are also active right here. So if you have any question for her, she's right to give you all the answers. Good morning, Madam Edna.
Good morning, JK.
Happy New Year.
Any returns?
Yeah, finally we get to meet again.
Yeah.
We're grateful to God for life and all that. But today we're breaking the ice. We're talking cervical cancer. I think it's something anytime we talk about, the women come in mind. And I don't know how the man, the men to, play a role in there. But let's delve deeper and break the ice. When we talk cervical cancer, what does it mean and what does it stand for?
So first of all, let's know what the cervix is, so then we can relate to what is. Yes, so the cervix is actually at the lower part of the uterus, which is the womb. So coming down, it helps in during pregnancy, protects the baby from infections that may travel up, and then as well helps stop infection in your normal day as a woman. So the cervix is actually sort of a protective something during pregnancy, delivery, and as a woman in general. So if there's an issue with the cervix or there's a cancer in the cervix, then it means that the whole female reproductive system has an issue. Yes. So cervical cancer itself is just the cancer of the cervix. When we discuss breast cancer, we only said cancer is just an overgrowth of cells in a particular part of the body. So it means that there's a lot of growth in there. The cells are not going through the normal cycle of grow, die, and then regrow. They keep growing and never stop. And then they change the DNA of the system. So they keep growing, they form a tumor, then cancer, then it starts affecting other parts of the body.
Okay, so talking about age limit, at what age can one, is at high risk of getting a cervical cancer?
The risk itself is you being a woman in the first place, and then having the cervix or the uterus, because the uterus is connected to it. Yes. So usually from age 18 and above, a woman is at risk. Yes. Okay. But the fear is that having early sex, early exposure to sex increases your risk.
Wow.
Yes.
So no matter the age, so far as you're open to
you're
sex,
open to it. So it means that the cancer is caused by what we call the HPV virus, a human papilloma virus. So this is what happens: continuous exposure to sex, multiple partners, or multiple partners from your partner's side. So this is the ripple effect. If my partner is sleeping with a lot of people, and I am sleeping with just him, indirectly, I'm sleeping with all the other people my partner is sleeping with. It's as simple as that. So if any of those people in the chain has come into contact with the HPV virus, then by chance I have it.
I mean, I was about touching on the HPV virus in the sense that we can't do without that when it comes to cervical cancer here and there. And you have touched on one possible cause of cervical cancer. Let's talk about the other causes as well.
Okay, so aside the early sex and then multiple sexual partners, our use of oral contraceptives, prolonged use of it is one of the causes. Prolonged use of oral contraceptives, yes, is one. And then having multiple childbirths, more than 3 and above. So the main reason is really not known, but some scientists have explained that it means that this individual is going to be continually exposed to sex, one, and then 2, the hormonal changes that happen during pregnancy, childbirth, and then all those things that happen during pregnancy can increase your risk.
Right.
And then when you have a low immune system.
Low immune system.
Yes, so low immune system may mean that the person may have any form of condition, for example, HIV or TB, or the person is taking some medications that will reduce your immune system so you can go through some sort of a surgery. Yes, and then smoking. Keep saying.
I'm not surprised. It costs a lot.
A lot, yes.
It costs a lot.
Yes, smoking. And then there are many other ones that, as we discussed, will pop up.
Okay, the oral contraceptives, right? I know that usually when someone is diagnosed of polycystic ovarian syndrome, that is one way of treating it. You're helping you menstruate here and there. And usually when you start that contraceptives, you take when you take the set, I think it's for 3 months, the monthly one for 3. So now you're telling us that, intake of oral contraceptives can cause cervical cancer. But then, assuming I have polycystic ovarian syndrome, I've been given that medication as well to help me menstruate here and there. How do I deal with that situation? Because this is not something intentional that I'm trying to prevent pregnancy or anything. I need it for my menses and all of that. And you are telling me this. How does it work? I'm really confused.
So in the PCOS condition, you're going to see a doctor. The doctor tells you, okay, this one is good for you. But you realize that in our time, in our generation, so I tell my friend that I use this contraceptive, it worked perfectly for me. So I realize that the person just goes to the pharmacy and then buys that contraceptive. A lot of us are not discussing with our healthcare providers which contraceptive is good for us, per my schedule, per how I work and my immune system and all those things. We don't go discussing it. We just go because other people are taking it. And then we take it for a prolonged period. With the PCOS case, they are told, there are even some who take some of the pills on the sachet and not all of the pills. Some take only the brown, some take only the white. So it depends on what the doctor has advised you to take. But prolonged exposure to, even in that case, there's a break in your intake at a point, yes.
All right. So I'm very particular about menstruation, right? Some people like the ladies to talk to them. Oh, okay, I'm having unusual bleeding and all that. Are they at high risk of cervical cancer?
So one of the symptoms of cervical cancer is high bleeding.
Okay.
But the point is that each individual should know him or herself for herself. Point is that before I started bleeding or menstruating as a young girl, that is how my flow has been.
Okay.
So a change in it plus other symptoms will prompt you to go into the hospital. But in natural fact, if you're having excessive bleeding during your flow, your period, you would have to see the doctor, because increased flow may increase your risk of anemia. And then it will in turn affect your natural body metabolism. So it is right that you go to the hospital so that we manage it and then give you some supplements that will balance the loss during the end of month flow. Yeah.
All right. Let's delve deeper into the whole HPV thing, because I think it comes with a lot. So I want to really understand what it is and how it's connected to cervical cancer.
So HPV by itself is the group of viruses. There are about 150 strains of viruses. So there are about a few of them that causes the cervical cancer.
Okay.
But we all come into contact with it once or twice in our lifetime, and our human system flushes it out naturally. But in some people, it happens that the continuous exposure to it, so it doesn't go away. The body doesn't have the time to keep healing and then taking it away, so it keeps coming and coming, and then it's there and then the cancer starts. Okay. And in some people, we've had infections while we're growing, and then we don't go to the hospital to have it treated appropriately. So you realize that most individuals, they will say, some people are saying that some urinary tract infections lead to cervical cancer. The point is that if they go untreated, it means that the HPV virus may come into contact. It creates a room, for example, chlamydia. It creates a room for the virus to grow. So then, indirectly, you will link it to chlamydia. But it's not as if the chlamydia actually resulted in it, but it gave it the room for the HPV virus to thrive in there.
Right.
And it is appropriate that you have an infection, you go to the hospital, we take tests, we take samples, let's know which of the HPVs you've come into contact with. Then we know how to treat it right for you. Other than that, it's going to be there, another one will pile up. There are about 150. We don't know which one you're carrying. So you don't know if it's the cervical cancer causing ones that you have. And then you keep treating, you're having foul discharges, you keep treating, and then it's not going. Then you're increasing your risk.
All right. Okay. So what then is HPV? I just want to understand the whole, it's a virus, I understand, but is it like an abbreviation or that's just the name for
So
it?
it's human papilloma virus.
Human
papilloma
virus.
Yes, so the papilloma is because as they pile up, they form what we call, it's a it causes tumors. So like in our science terms, we call it papilloma.
Okay, now I'm very particular about the discharge in there. We have some women, you talk to them and they see different colors of, discharge coming in. They are not really certain, or they are not able to tell what is actually causing the discharge. So can we have a fair idea how it looks like? Is it browny? Is it bloody? Like, when you're having these discharges?
So the natural female discharge is not supposed to have a foul smell.
Okay.
It's not supposed to be blood stained. It's not supposed to be that's so heavy. So some people have it and they tell you it looks brownish, it looks creamish, but it depends on every individual and how he is describing it. But the point is that it is happening at a point when you're not supposed to have discharges.
Okay.
So I'm a lady. I know when I'm ovulating, I know that this discharge is an ovulation discharge. And this is how it smells like. It has that, the smell is not as foul as dead fish.
Okay.
Okay.
Yes. Or rotten egg. Yes. So if it's having that offensive foul smell and sometimes has blood in there, then there's a pointing factor that there's something wrong down there. So you would have to see the doctor.
You have to see.
You have to see the doctor, yes. And in some cases, some other symptom is you're bleeding between periods. So let's say I had my menses on the 1st, for example,
Yes.
and then I'm expecting that give or take by 1st February it should come again. But I realize around 12, 13th, then I'm bleeding again. So I'm bleeding between periods. It's cutting through the period. Or you realize that you're using the washroom and then you don't have any condition that will cause you to lose blood through your stool. Realize that there's blood coming through your stool. Painful sexual intercourse, and then you realize that you're discharging blood at places that you're not supposed to discharge blood. Constipation, pain around your abdomen, and all those things are some of those symptoms you should be looking out for.
All right. I mean, you've said it all. Inward and then physically the symptoms that happen. But let's talk about, I believe that individually we are all different, and so I may see this first symptom, you may see the other one. But let's talk about the sudden one that is quite general that you are most likely to experience when you are having cervical cancer. The most common and sudden one that anyone can experience.
So the starting of the cervical cancer has no symptom. Just when it's precancerous, you don't see anything. So we advise that you keep taking your pap test. So it doesn't show any symptom. But the first symptom that is most common among a lot of people is the foul discharge.
Right.
Very foul discharge. That is very common because it's at the cervix area and every woman has the cervix. So it comes out around that time and then you realize that your bleeding also changes, your pattern changes. Those are those cardinal ones that most people report with.
I believe that most of these diseases out there are lifestyle related, the way we eat, the kind of things that we engage in here and there. And you mentioned early exposure to sex can be a factor, smoking as well. Let's talk about other lifestyles that we involve ourselves in and how it can have an impact with this whole issue we're discussing.
So not taking in a lot of vegetable diets.
Hey,
those things that boost, yes, fruits and vegetables, you just have to boost your immune system because like I said earlier, your immune system controls. A lot of us have, I may say all of us have come into contact with the papilloma virus.
One way or the other, because there's 150 of them.
Yes,
or more.
150 of them. Oh. So by chance you may have come into contact with it, but your body has flushed it out. So if you have that lifestyle that will not boost your immune system, not sleeping well, not eating well, smoking, alcohol, and then exposure to a lot of sexual partners and not protecting yourself. Yes. So you know what? The papilloma virus thrives even during oral sex, anal sex, vaginal sex. So whichever way, so you realize that some men have penile cancer, HPV was there. People have oral cancer, HPV was there. So as much as we are talking about the cervical cancer hitting on women and other things, the men will have two, yes.
Okay. I've been talking about the HPV. I know there's a vaccine that helps and all that. So the way it treats with the women, is it the same with the men? Are we also when you go for the vaccine too, is it going to help in a way?
No. So the strand of the trace of that virus that causes the cervical cancer in women is the 14, 15, 16, and some other numbers.
Okay.
So when we take the test and realize that, so this is the cervical cancer causing HPV, then you can, so it is for women. Those, the HPV shot is for women.
Okay.
But there are those shots that are given to men to protect them because of the trace of the HPV virus that they are carrying in that particular cancer they are suffering. So this one is for us, unfortunately.
Interesting.
Okay.
When it comes to diseases that affect women the most of it we can't do without genetics playing a huge factor there. Let's talking about cervical cancer. Is genetics playing a role in there?
Yes, so a family history of cervical cancer means that you stand that risk of getting it.
Okay.
So if it is not you, it may happen to your sister or someone else, a female, another female in the family.
Okay, Doc, you said that with the symptoms, it's not really sudden, like you can't really see, it just gets you like that. But then usually we are told that, or you keep preaching this gospel that when you detect something very early, it helps in the treatment. But then here again, you are saying that when it comes to cervical cancer, you can't really tell. The moment you start this, you start seeing symptoms, it means it is happening in your body, in your cervix and everything. So let's talk about how early detection can help with the treatment. How good would that be for us?
So we advise that every woman, so long as you've been exposed to sex, should take the pap smear test at least once every 3 years. At least
once every 3 years. I mean, JK, is not bad. I think we should.
But a lot of women fear the test. Let me just bring that out. A lot of women fear the test. It's one of the most uncomfortable tests we have in the medical field for women, because you're going down there and it's uncomfortable. So let me just briefly talk about how the test is, so that you have a fair idea of what you're going in for when you walk into the facility. So first of all, we prep you. But I was supposed to bring the kit today. I'm hoping I'll come next week and I'll bring the kit. So
since it's the month of cervical cancer,
exactly. So we have what we call the speculum.
Speculum.
Yes, it has the tip like the beak of a bird, but it's bigger. Unfortunately. So
can you see his face? I mean, you're not even a woman and you're wearing that face already.
So what happens is we lubricate it, and then we allow the woman to lie on her back, like you're going to deliver, on your back, and you spread up. So you lubricate it because it's not what is supposed to be in there for a woman. So it's usually difficult for a woman to be moist when you're inserting it. But we try to calm the woman down and then talk to her that you have to calm down, because if you don't calm down and I insert, it's going to cause pain. Yes, so that's what happened. And a lot of people who went through that pain broadcasted it, that it's painful. So lots of women don't go for it, especially those who started at the time. Now, when it's inserted, as you insert it, you open up. So it has a screw that opens it up. So as you screw it opens it up.
Genital.
Yes, the speculum opens up and opens your, so we can see the cervix in there.
Hi, this is.
It's not painful. It's uncomfortable.
It's not painful,
but uncomfortable
because of the fact that you are trying to bisect and you know get in there.
Yes, I have to see the uterus. I have to see the cervix, and then so I'm going to put this with some of the test kits. It's a brush, and then let me use in layman terms. It's like the ice cream spoon. You see that stick? Yes. So first you clean the place, and then we use the brush to take a sample. We are taking samples from the cervix.
I imagine it's a very soft brush.
Oh, very soft, tiny, and very thin.
Like for toddlers. Or even softer than one.
So it's very soft. Very soft.
So the sample that has been taken, is it like the watchy thing in the ladies thing that has been brought out by the spoon we're talking about?
Sometimes you go in there and you find that. And in some cases you even find blood stained samples there. So it depends. And
And is it normal to see a black stain in?
It depends.
Okay.
Maybe the person is due for menses. The person is
okay.
yes. So we advise that you don't come in when you just finished menstruating, or you're about to.
Okay.
Yes, or you've just had sex in the last 48 hours, because I might end up picking sperm samples instead of
what you are supposed to take.
Unfortunately. So yes, we take the samples and then we use the ice cream stick to also pick the next sample, put it on a slide, and then protect it, cover it, and take it to the lab. So continuous tests will if it's abnormal, we take it to another pathologist to tell which kind of HPV the person is carrying. Then the treatment follows from there.
All right.
So that you're not caught by surprise. You have to keep testing.
All right. Let's talk about the stages of cervical cancer and how it influences the decisions. Obviously, if it's, let's say, I don't know the stage, but let's start from stage 1.
Stage 1
so
to 4.
obviously, I'm sure stage 1's treatment will be different from that of stage 4. So let's talk about the various stages, how it is, and the mode of treatment.
So the treatment itself, just as you said, is per stage.
Okay.
So from stage 1 to stage 4. Stage 1 is just in the cervix, in there, and it's really not metastasized. It's not gone to other places of the body. So the cervix is between your bladder and your rectum. Your rectum is where, excuse me to say, your poo passes. Yes. So if the virus continues to stay in the stage 2, it is going to other parts of the body. So you could find it in the bladder, in the rectum. The third stage, it is going to other parts. Then fourth, it has affected sometimes the kidney. So usually among the tests we do kidney tests, urine tests, and other things to see where it has gone to. So per stage, if it is at stage 1, usually it is just surgery, and then we take the cancer off. But as it continues and progresses, we use chemo, we use radiation, and in some cases we take the whole uterus off.
Wow.
Yes.
Oh.
Yes.
I'm
We
very,
take the whole uterus off.
That
so
is sad.
let's talk about fertility.
Yes.
So it goes into affect fertility where maybe probably you cannot give birth again.
Yes, yes. Even with in some cases of stage 1, when we go in there and depending on the size at that stage, it affects the natural system of your cervix. So it will happen that such a person will keep having miscarriages. Such a person the system may not be able to hold or protect pregnancy. Yes. And then if it is taken off, then it means that completely you can't have children anymore.
Can't have children.
Yes.
But you can enjoy sex.
Oh, of course. Your vagina is still there.
There's no baby.
There's no baby.
Still on treatment, doctor. Are there any new advancements with regards to cervical cancer treatments?
There is just the normal ones we have. Just that science is pleading with people to volunteer themselves so that we can learn more and then add more to the studies. So if there is anyone there, you go to the hospital, you can say, well, you can use me as one of your tests.
I'll volunteer.
You volunteer.
Yeah, you don't have the
volunteer.
cancer. You don't
Also,
have
you
the
need cancer patients too.
Yes,
Of course, definitely.
So we try other treatments that we think will work. Yes.
To see.
Yes.
Right. It's cervical cancer awareness month. Let's talk about the education, how you're trying to put the word out there. And let's talk about, are people stigmatized when they realize that they...
Or her grandmother did this, her grandfather did that, that's how come she's suffering this. Listen, in the medical world, we don't do spirituality in there. But we end up getting people attacked, stigmatized, and then talked down on, especially in their communities. And then naturally, the person has that burden already. That, for example, I've never had kids. And then I'm suffering this, and I may end up losing my potency of carrying babies. And then you're adding this one to it. So the stigma is seriously out there. As much as we are doing the education, it's really not going out there. I think we have to do it more. We have to talk about it more. Because I am seeing that, we are seeing that most of the young girls of our time, or the young people of our time, I inclusive, are experimenting sex and other things. And like I said, if you are not sleeping with multiple people, your partner may be doing it, or vice versa. So it means that you're exposing yourself, whether male or female.
Female, yeah.
And if you're doing that, maybe I didn't do it, but you brought it upon me and I'm going to suffer it. So I advise that we protect ourselves as we are experimenting sex as well. Let's use the condoms, because it's a sure way you can prevent yourself from. But if you're doing oral, if you're doing other sides, then it means that I can't protect you. But the stigma is there and the education is low, way low.
Very low, right? Okay, now I just want to find out from, you know, after treatment, sometimes with some disease and all things, that we have recurring, you know, things coming again. With cervical cancer, is there any, are we at high risk of, you know, seeing it coming again in the future?
So cancer by itself, most documentations will tell you that it can be cured.
Okay.
Early stages. But if it goes beyond, so let's say stage 4, we have what we call the remission. So it is gone, but the chances of it coming is about 20%, depending on how well you're going to live your life again, how well you're going to protect yourself so that it doesn't cross over.
Let's talk about aftermath of cervical cancer treatment. How is the life of the woman like? Let's, especially someone that has been through all the stages. Oh, for stage 4, we know that eventually you have your uterus removed, emotional trauma here and there. How about the first, second, third stages? How is their health like, their immune system? How is everything like after treatment?
So it will take quite some time for you to bounce back to normalcy. It will take quite some time, but it is advised that you take good care of yourself, and then you're eating well. You go by the regimen the doctor told you. So until the doctor says you can go off your medications, you don't stop. And if you've been advised by anybody that, oh, this medication, my grandmother used this herb or that homeotherapy, all those things, yes, you should talk with your doctor. He's able to compare, he or she's able to compare and then give you the go-ahead. Because we do certain things that reduces our immune system, puts pressure on our kidney and our liver, and a lot of things. Then we end up aggravating the condition. So we advise that, yes, they should really take good care of themselves. And then life after it is not a death sentence.
It's not.
It's not a death sentence, but it will take time. With some people, giving birth will be an issue. With some people, they can have maybe 1, maybe 2. But if it doesn't happen, so it is not the end of the world.
It is not
you
the
can
end
definitely
of the world.
adopt someone.
Right. Viewer at home, this morning we are learning a lot on cervical cancer, and this morning being the awareness month. See, it is not like malaria that JK will see me having sweat all over or shivering and tell me to go get a test done. You need to get that test done. We've mentioned a few things that could amount to that, sexual lifestyle, having multiple partners. So please be honest with yourself. If you fall in line in any of these areas that we touched on, please go and have that checked up. You don't want to get to stage 4 where you have the uterus removed. Be honest with yourself and get yourself tested. Doc, let's talk about ways of, you know, preventing this cervical cancer. It's lifestyle related. Aside as, you know, checking the number of people that we sleep with, reducing the number of sex partners, let's talk about other things that we can also do as well that would prevent us from getting cervical cancer.
So it is advised again that if you have any form of infection, I'd rather go to the hospital than walk to anywhere and start taking any other thing that you feel will cure whatsoever you're suffering. Yes. And then eat well, sleep well. And alcohol and smoking. Every day I ring that bell. If you've not started, please don't start, yes. And if you have, find a way to control and then stay away from it. And then it is right as well that you protect yourself. If you're taking contraceptives, you should speak with your healthcare provider before you start taking anything. And then prolonged exposure becomes a problem. Now, early sex, we advise the young girls or young people that at least wait until after 18. So then your exposure to sexual activity won't be from a very long period of time. You know, around that time, the thing now, you are stealing and doing it. So when something is happening, you can't tell anybody what is happening to you.
Yes, that is very true.
It becomes a problem. You can't tell mommy, this is what is happening to me. Because when we were kids, if you have malaria, they'll ask you, are you sure you're not pregnant?
Yeah.
Yes. Yes.
So when you're sick, you can't go telling your mom that you're sick. I plead that the mothers will also cut down on, are you sure you're not pregnant thing. I can't remember around that time if if I'm sick or I'm having severe menstrual cramps, I can't say anything because it is either you are sick or yes, I live in a compound house. Either you are sick or you are aborting a pregnancy or but at that time most of us had not even come into contact with sex. Yes, so I plead that mothers will also come so close to their children. So even if I have done it, I can still confide in you. Yeah.
Ah, okay. But can one bleed with a bleeding? Can it lead to death?
If it continues, you're not telling anybody, you're not taking any medications. Yeah.
It can.
Severe anemia leads to death.
Wow, that's interesting. Quite an interesting conversation. I think so. This is going to be an episode, right? We have a lot to talk about here. So I think wrapping up, I don't know what you're going to tell our viewers this morning. I know definitely you're going to say they should go run test and check themselves and all that. But let's talk to them. Yeah.
So I advise that every young girl, so long as you're exposed to sex, should take the HPV test, what we call the pap test, the pap smear test. Like I described, it's uncomfortable, but it's advised that everybody takes the test. And Health Verve Connect is available to do mobile screenings for churches, groups, and organizations. So you can link us up on all of our social media handles and call me on 0244959642 so that we get you screened. And then the vaccination is very important that each and every woman does the vaccination. JK, you know that government piloted the vaccination at a point.
Okay.
And then, yes, it halted, yes.
Why? What's
unfortunately, they said funding, yes. Initially they said funding, and our mother said they were injecting some things into us at the time because education was very poor.
Oh yeah.
Very poor.
It's so poor.
Very poor. Very poor. So just as you take your babies for normal immunization, polio and all those things, it is right that your daughter or your baby girl who has never had sex should take the HPV shot. And if she has, you take the HPV, the pap smear test, then the shot.
All right.
So if she's not exposed, you can just do the shot straight. But if she's exposed, we do the test and then we do the shots. And it's very important.
Right. Thank you so much for joining us, Dr. Edna. You've really enlightened us on cervical cancer. And as I said earlier, be honest with yourself and get tested. Be honest with yourself and get tested. If you know you're involving in various lifestyles that we've mentioned this morning, you want to check that as well. The drinking, the smoking, and the multiple sex partners. I know some of you are very adventurous. Some of you want to explore and do more. But please, your health matters. Your health is your wealth. And so thank you so much once again for joining us. We'll go for a quick